City is going to welcome you with the day's proverb for this couple of, is it the fourth week now or is it the third week? The third week that we've been south of Sahara. Excuse me, Miss Maina. South of the Sahara.
This is the third week.
And north of the Limpopo.
Yes.
Is that your region?
That's exactly it.
Yes. Where are we?
We are in the Republic of Burundi.
Do you cover that as well?
That would be in the Western Central Africa Regional Office. But we all work together in sincerity.
Okay.
Western, Eastern, Central.
Of Africa.
Of Africa.
Okay. We're in Burundi.
According to the cow, God has a wet nose.
According to the cow, God has a wet nose. Who wants to go first?
According to the cow, God has a wet nose. Okay, so cows have a wet nose to begin with. Could it be the cows think so highly of themselves that they liken God to themselves?
That is a very interesting perspective. Now that you've spoken on behalf of the cows, yes.
I don't know. I'm thinking wet in terms of the rain, mvua. And so thinking the cow, by the time it's making that analysis, is because it's been raining, and so there's food. And the cow is just acknowledging that there's a source of that food, who is God. I think so.
That's a good one. Oganga.
Must say it's an interesting proverb, but probably just like what Rachel says, it means the cow acknowledges that for it to have the wet nose, there is food, and it must have come through some, supreme being else somewhere. Yes.
Sylvia, like yours.
Out of the box, huh?
Yeah. That cow thinks that it is created in the likeness of God.
This is it.
Right?
Or God is like it.
Oh, God.
Conversely.
So what does that mean?
Well,
what would the proverb then be saying?
What would be saying? I guess that there's an interconnectedness between everything in creation or nature. City doesn't like my description. Yeah, but basically that everything links with the other. Everything speaks to the other. Yes. That we are all the same, so to speak.
So you're saying
cows and God.
Cows are the same?
No.
Cows and
That's
God
the
are the
cow's
same.
perspective. Speaking as the cow, yes. There's that interconnectedness between the cow and the supreme being. Or interconnectedness of life.
You put it well. You see, this is the thing about asking you your opinion, because that's what we've heard, and that is good because it provides with that diversity. Now, what do you think it means?
Can we ask Latiff to answer that?
He will not answer.
No. Me, I am not. Mimi siko kwa hii exam.
Hauko kwa hiyo exam?
Mimi ni AP. Niko na bunduki. Mimi niko na bunduki hapa nje. No cheating.
No cheating. Why are you looking at your neighbor? Why are you scratching?
What do you think it means?
I don't know, City.
Today's proverb is tough. I saw somebody, Alcags had attempted. He has actually sent me a message. Let me look for it. And he says, you know what, today's proverb, I think it has a meaning. Where is this message from Alcags? Maybe I'll read it tomorrow.
Tomorrow is good.
Even tomorrow. Tomorrow is good.
No, tomorrow is good.
Oh, here it is. That proverb for today, my interpretation, a cow only sees as far as it knows. Like many people.
Yeah, that's an interesting.
So where does the God aspect come in there? Because I agree, that's a good perspective, but where is the God aspect in that?
Consider also the community from whence this particular proverb comes. What is the relationship with cattle?
You said Burundi.
Yeah.
Yes.
Should you tell us?
What do you mean? I've just given a hint.
Yeah, we don't know. What's the relationship between the people and the cattle?
Well, they are cattle people. Yes.
Cattle are revered.
Yes. They are cattle people.
So they see things through the eyes of a cow.
Well, the cow is revered, as you correctly put it.
Or the cow is right up there next to God.
Well, the cow provides you with very many things. The right up next to God are the Hindus. They're the ones who have that relationship with cows. But they are not the only people who look at cows as the giver and provider of life, cows as the provider of sustenance, and very many other things, because cows are used for plowing, cows are used for food, there's hardly anything you for clothing, there's hardly anything you do not use cows for.
That's true.
For swag.
Yes. Exactly.
For those fancy leather products.
Yep. Okay.
That's a good one.
16 days of activism against gender-based violence. This is an annual international campaign that kicks off on the 25th of November every year, which is the International Day for the Elimination of Violence Against Women, running until the 10th of December, which is the Human Rights Day. It was started by activists at the inauguration of the Women's Global Leadership Institute in 1991, used as an organizing strategy by individuals and organizations around the world to call for the prevention and elimination of violence against women and girls. I'm reading this from the UN Women website. Every year, the Unite campaigns focuses on a specific theme. We'll talk about that for this year, because this is what the UN Secretary General in 2008 did, launch the campaign called Unite by 2030 to end violence against women, which runs parallel to the 16 days of activism. So a lot has been happening since, these days, right? But then if we look at the journey then to the journey now, and the theme for this year is Unite, Invest to Prevent Violence Against Women and Girls, are we saying that have we been making progress? Let me start with that. Have we been making progress, Sylvia?
Yeah, I think, first of all, this is a very important season, I think, for anybody in the gender space, but I don't want to limit it to the gender space, because we all live in the same society, which is more or less half men and women. So this affects all of us. Has there been progress? Maybe we need to see where we're coming from to know where we are, and then determine whether there's progress. But I think as an intro, I would say yes, there has been progress, but a lot more needs to be done. So I'll say that from a regional perspective, and I know Caneble and Rachel here will talk about it much more deeply from a Kenyan perspective. But there's progress, although it's kind of mixed. It's a mixed bag. We have issues such as conflict, humanitarian crisis, and other such issues which have rolled back some of the gains. We're still recovering from some of the effects of COVID on GBV, including SGBV. When I talk about conflict, of course, we think about countries like Sudan, which are really still very much in the thick of it. And there are some data points that are very alarming, like 6.7 million people in the country are at risk of GBV, and some of those include men and boys. So, to answer you in short but long, is there progress? There is, but there are a lot of red flags as well.
Rachel, you work as GROOTS Kenya, you work in the grassroots. That's the GROOT part of the the grassroots. And I'm sure you deal a lot with these cases, on a daily basis. Is it an increase? Is it more awareness? How would you describe it? Because presently, the whole country is actually is having this conversation about, femicide and all, and GBV, SGBV, right? So is it that we are now more aware, and so there's higher awareness and therefore higher reporting, or is it that there's an increase?
I would say both, Latiff. Both, in the sense that, yes, is that awareness, and now because people are speaking up. A lot of the campaigns that we've been running for many, couple of years now, is we say, speak up, speak out, do not be silent. So we believe that, yes, there's quite a number of women and young women and, all those who are affected who are speaking up. But at the same time, Latiff, there is an increase that is undisputable, because we are all here in Kenya and we are watching the news and we are seeing what's happening. But at GROOTS Kenya stands for Grassroots Organizations Operating Together in Sisterhood. We have who we call GBV responders. They are gender-based violence responders who are Okoh, tunasemanga mashinani in the communities. And what they're telling us is that every other time they're being called, there's an alarm, there's a call, a distress call, an SOS call to help of a young woman, of an old woman, the diversity of it all. when you think about how we started this year, Latiff, we started this year with a march. We're calling it the Femicide March. And if there's any indicator is to see how many people were on the streets, over 10,000. And these were organic people who came up to really say, we are here to speak up. So when we think in terms of increase, I would say both in terms of reporting, but also in terms of what tunasikia huko kwa ground. The other statistic that was very recent is the one that has also gotten us really angry and really becomes very unacceptable, because what we are saying is that every single day in the last 3 months, there's been a woman who has died because of femicide. Dying because you exist as a woman. I think then we can, confidently say the increase is on both from where we sit. Yeah.
Let's bring in the statistician. Okay. Now, this is now where we should have the undisputed data. Is there an increase? And is the increase attributable to awareness, or is it just attributable to actually cases of gender-based violence increasing?
Yes, thank you, Eric. I think from my perspective, in the context of data, I would say that there's been a lot of progress in terms of even the ability to be able to measure the cases of gender-based violence. And so it's quite important that also to policymakers, they are really able to see that the impacts of some of the policies that are coming up are informed by evidence. And by this, I would like to refer back to currently in the country, we have GBV as one of the triple threats alongside HIV and teenage pregnancy. And so along with that, you'll see that based on the 2022 demographic and health survey done in Kenya, just to give an example, you'll see that when you look at the percentage of women and girls, of course those in the age of 15 to 49 who have been subjected to who had been subjected to physical violence, especially in their lifetime, you'd see that it was quite high in terms of also looking at some of the counties like Bungoma, where it was at 62%. And so these are some of the, like now Bungoma also as a county, you'll notice that even when you look at sexual, violence, it's still one of the counties that sexual violence is high. Nationally, based on that survey, it was at 34%. But then...
I apologize.
Yes.
When you say sexual violence, what do you mean?
Of course, sexual violence comes in, or is measured in various aspects. And one of them is, when the survivor is subjected to doing forced sexual acts, or rather, they are either subjected to situations like rape and all that against their wish or their consent, then that amounts to sexual violence. And
this data covers the entire country.
This data covers the entire country.
So let me give you my raw interpretation of what you're saying.
Yes.
That there are counties that have more rapists than others.
Countries where rape occurs more frequently than others.
No, rape doesn't occur on its own.
Okay.
There is somebody who perpetrates it.
Indeed.
Yes.
So is it a reporting issue that more people are more aware, so they report more of these incidents? Or is it that there are actual incidences of rape and that the reporting measure is the same, but what is reported in some of these areas is more than others, as I said, which equals the perpetrators and rapists are more in this particular place than others?
I think this is why we undertake surveys, to really be able to help to get the real information, and especially from the victims or the survivors in this case. And as you are putting it, of course, there's been that advocacy efforts that have been put across board. And so it's really important that we are also able to collect or gather data so that we are able to also get to understand. Because if you look at the statistics, you'll realize that 71% of the perpetrators, are like intimate partners, either the husbands or the male partners to women who are in union. And interestingly, you still see that most of these survivors, when you look at the referral pathway, they begin with first going to the family members, who in some instances could also be the perpetrators. So in that context, then you'll realize that to some extent, they could also be in a way be intimidated, for them to come out and report some of these cases. And mind you, there are some communities in the country where you'll find that they would rather resort to alternative dispute resolution mechanism, whereby they do not want to go through the non-judicial system. And this is why we keep on ensuring that there is more frequent data. So from the 2022 Demographic and Health Survey, currently the National Statistics Office is again planning to undertake another mini demographic and health survey. And so we'll also be looking forward to see that these cases are somehow also reducing, and most importantly, that the survivors are also being able to get justice. And that's why you'll see that across the country, there are a number of counties that have been able to come up with sexual and gender-based violence policies, which have in turn informed the creation of SGBV courts, so that the survivors are able to really get justice within the shortest time possible.
When you collect this data,
Yes.
is there anywhere where you consider the relationships that men have in these communities have with women? One, men have with women understanding their sexual or reproductive rights, and B, the position that women have in these communities, because it can't be that there is that degree of violence being meted against women without us asking ourselves, okay, how exactly do men relate to women in this particular community, or how? Yes.
There's a lot to unpack there, and I think in a previous conversation we talked about the interlinkage with poverty. That's a huge determining factor, because the less empowered women are, and that's why we keep harping on women economic empowerment, and that's part of our mandate as UN Women for gender equality and women empowerment, because we recognize even from anecdotal data that once women are empowered financially, they are less likely to be subjected to some of these practices, right? Even harmful traditional practices, like even FGM and the rest, which are also considered part of GBV. So maybe we should even have started by unpacking what is this GBV, what does it entail? It includes economic violence as well. Of course, there's emotional violence, right? Under SGBV, which is sexual GBV, we also talk about defilement and incest, right? Child marriage as well. Those are all instances of GBV. But to answer your question, Siti, about these incidents with intimate partner violence, the numbers in Kenya actually resonate with the global figures, right? So the figures that we have this year for 16 days of activism against GBV, every 10 minutes, a woman is killed globally. That was from 2023 data, global data. The year before that, it was every 11 minutes. What does
Global
that say?
data is an aggregate, is it not?
It is.
Yes.
It is, but the data actually triangulates within itself, if you can see. Those numbers resonate. Even the numbers that we got globally for GBV in COVID, when you disaggregate them down to the regional level, even as Caneble is saying, down to counties, you would find they actually resonate with the numbers that were being seen at the global level. For example, Kenya was one of the unfortunate shiners, because now to answer your question of whether is it more reporting or the higher incidence, there was a rise, I think, to, is it 743% or 700 and something percent increase in GBV reporting during COVID. Yes, I said what I said. Yes, I know, I had to look at that number.
I'm not doubting you.
Because I thought it was a typo.
700 and what percent?
700 and I think 43%, 700 and something percent increase in reporting during COVID. Of course, we know the drivers being locked in with perpetrators. But again, we see that higher incidences of GBV, especially SGBV, actually both physical and sexual, are perpetrated by people who are known to the victims.
Socio-economic factors and how they contribute to this.
So I am a woman. I am at home during COVID, or even not during COVID. It could be just a regular day. Sina nguvu, sina uwezo, right? I have no job. I depend on my husband or significant other for everything. So I cannot raise my voice and complain if he does something that I do not like. Or if I make the mistake of over-salting the food. I'm using actual examples from data. Or of dashing to the neighbors to pick something and leaving the children unattended for 5 minutes. I should expect a beating. Now, what's even more disheartening, and I would even say twisted, City, is that the perceptions of women and men when it comes to GBV are very shocking. There are many women who actually think it is okay. Like, do you deserve to be beaten for burning the food? And they say yes. Do you deserve to be beaten for going to the hospital? You talked about access to reproductive health care. That was one of the huge issues even during COVID. But you see, again, COVID just brought out these issues louder, but these were issues that were underlying already. Do I believe I should be beaten for going to the health clinic without asking permission from my husband? Yes. I do. Yenyewe nilikosea. But if I'm a quote-unquote empowered women, and empowerment is a very broad term. It's not just economic, yeah? There's also information. I mean, even access to a mobile phone is part of empowerment, yeah? Access to digital technology is another level of empowerment, yeah? If I'm empowered and I'm able to call my own shots and say, you know what, I'm going to go to the shop and there's nothing you're going to do about it because I bring as much as you do to the table, so to speak, yeah? Then you see the differences. But you notice actually where poverty is higher, you're more likely to find prevalence of GBV is higher, or the incidence.
Our conversation today is on 16 days of activism against gender-based violence. This begins on the 25th of November, going all the way to the 10th of December. Rachel Kagoiya is the Executive Director at GROOTS Kenya. Sylvia Maina, Regional Gender Communication Specialist at UN Women for East and Southern Africa, and Caneble Oganga, who's a Program Specialist Gender Statistics Advisor at UN Women in Kenya. So, Siti, unfreeze yourself.
Consider myself unfrozen. There is a certain correlation between, one, the socio-economic factors that people have within communities, and that brings about what we call a gender or balance or imbalance, or whatever it is. However, much as that reason has sufficient data to support it, it has been used as an excuse to support trends and practices that should have been outmoded and outlawed a long time ago.
Correct.
Because how is it that some communities believe that beating up women is a good thing? Forcing women to do things they may not particularly want to do is a good thing. How on earth does that become something that you can laud and say it is a cultural norm? And you actually voice it and talk about it as though it is something that everybody should understand that it is normal. When a very key member of that particular community doesn't quite agree with you. So it means their view is completely disregarded.
But also in this day and age, all right, so many years after the UN highlighted this issue, so many years after the government of Kenya even also picked up this issue, it's been a number of years since President Uhuru Kenyatta of Kenya said, we are committed to ending GBV in Kenya by 2026. We are now coming to 2025. By 2026 means next year is when we are eliminating it, but we're still seeing it on the rise. What you've just given us, Caneble, statistics, Bungoma, 34% incidents of sexual violence.
That was national. Then 17.
17 in Bungoma.
In Bungoma.
That is very high, Bwana.
Yeah.
That is very high,
It's
Bwana.
high, yeah, exactly.
Bungoma is not one of those you can say it, it's an outward, far county that doesn't have much information, that doesn't have much presence of government. This is not.
I would say that I wanted to follow into the discussion you were having with Sylvia, that Bungoma, be as it may, when you look at poverty rates, they are also not quite low. They are significantly high. I remember from the integrated household budget survey done by Kenya National Bureau of Statistics, around Bungoma having still 53% in terms of poverty rates, relatively compared to other counties around that region. And so from what Sylvia was talking about, when we look at the issues of empowerment, then you'll realize that normally controlling behaviors are normally the precursors to gender-based violence in terms of denying the woman to be able to speak to other people, or insisting that they must be able to be granted permission, if they want to move to see their relatives and all that. So this is what in turn then graduates now to gender-based violence. And if you look at now in totality, the combination in terms of the various forms of violence, that is the physical violence, sexual violence, and psychological violence, then you'll realize that across the board, I want to give an example, Stephen, as you are saying that from the Lake region, it may not be high, but surprisingly, counties like Migori, you have Homa Bay, you have
Kisumu.
Busia, and also Siaya. These are counties that the rate of gender-based violence in terms of the three elements I've talked about is up above 40%.
I don't come from those places.
And so from the region.
Like for Kisumu City, I can tell you discerning. Actually, it's one of the hotspots marked by Kenya government.
Wow.
So Mombasa was one of them.
Yeah.
There's Kisumu, I can't remember the other counties, but they all have those specialized SGBV courts.
You will find counties that have major cities, because the thing with major cities, you also have low-income dwellings, and you have crowding, and those come with a completely different set of dynamics. Yes, so yes, the representation will be high in some of these. There's a reason why I mentioned, you asked about women and the freedoms that they have. It's often manifested by someone's ability to vocalize, to speak out. And I was telling you, the community I come from, women are vocal, but not all. Culturally, they were permitted to be vocal. That over time, because of the changing social norms and values, and the focus on material wealth and the role it plays in the lives of people, that has bastardized that particular system that was there. But violence was not something that, if you look at any community in this country, violence was not something that was accepted.
No, it wasn't.
Yeah.
It wasn't, but it's true. Urbanization has played a very big role. But there's still the element of social, cultural kind of thinking. There's a patriarchy. At UN Women, there's something we keep saying about the patriarchy pushing back. So it's all these gains that we've made, it may sound surprising, but they have angered a lot of people. I was looking back at the comments on our last discussion on the YouTube channel, and what shocked me, but also did not shock me, was the level of pushback from especially young people, young men, who are like, actually the reason that we're in this place with gender empowerment, GBV, is because we've listened to too many Western ideals. That's number one. And we've lost our culture. Mwachamila ni mtumwa. That was the argument. Number two, the other argument was that women have been over-empowered. And that has hurt men's egos. I'm telling you from the comments.
Is there such a thing as over-empowerment?
That's a very good question. It depends on now how we define the empowerment. What are the parameters you're looking at? But I wouldn't say there's such a thing as over-empowerment.
So the argument there was that women have been
over-empowered. So it has injured men's egos. Yes, so it's destabilized society. Right, so that's why men are retaliating. That was the argument in the comments. I've heard this a lot on social media as well.
Okay, let's discuss that for a bit.
Yeah,
is there?
It's an important point.
Is there an issue that because you at the grassroots, Rachel, you deal with communities, right?
Yes.
Is there a feeling among men that they are being emasculated? When the women are becoming more and more aware, more empowered economically, information-wise, and all, it's emasculating the men.
You know what, Latiff?
I don't know.
When you're talking about violence against women and gender-based violence, there are many layers to it. Deeply rooted with the many layers is power, is patriarchy, is culture, is religion, is all those enablers of inequalities and discrimination and oppression. So we cannot isolate a conversation that's talking about empowerment and violence and remove it from those deeply rooted, those entrenched practices that have existed for decades. I'll give an example of what we have in terms of also data now that we're talking about gender data. At GROOTS Kenya, remember I talked about gender-based violence responders who respond to GBV in the communities. Between December 2023 and October this year, which is like a year, right? The GBV responders have already responded to 1,059 cases. And these are people that they have been able to touch their lives and respond to and pursue them for justice, pursue them for legal actions, pursue them for medical and psychosocial support, move them to the shelters and safe spaces to be able to have a place where they can pursue other things. Out of these 1,059, this is within 3 counties. This is in Kiambu, this is in Kakamega, and this is in Tana River. Out of the 1,059, 443 are in Kiambu, 438 are in Kakamega, 178 is Tana River. But interestingly, out of the 1,059, 8 or 9 cases have been perpetrated by people who are known. And out of that 8 or 9, 736 are men within the communities that are already known. and this is data that we already have. Out of that number, we also have persons with disabilities. 30 cases of persons with disability. Out of these 1,059 that I'm talking about are women across different ages. In short, what we're trying to say, the data has a way of layering and showing these intersections, or being able to say what is, the question that you're asking, City, why, what is really happening? It is heavily, deeply rooted on systems of inequalities, systems of oppression, discrimination that are continuously rotating within these communities.
You know what I love about what you've said, Rachel? If I can just jump in, Kiambu, is it number 1, 2, 3 in terms of wealth in Kenya? I know it's among the top 5, right? On the list, right?
County.
Yeah, it's been up and down. You've said that they have the highest number out of those 1059. That has intrigued me. And Tana River has the lowest, 173.
Because we have to unlayer.
Exactly.
So let's think about what is happening in Tana River in terms of culture, in terms of religion. I think Caneble alluded to it. There's something called maslaha in terms of how they also want to address issues to do with GBV when it's reported. They want to do it with the kangaroo courts. So we cannot just isolate it and just use one. And then let's also remember violence happens in many forms. We're talking about violence that happens on our technology, the technology facilitated violence. We're talking about sexual violence, emotional violence, economic violence. Like there's so many rape, there's so many layers of violence that just when City or here seated thinking that because women are vocal in your community, then they're not experiencing violence, and then voila, they are actually experiencing violence when they are online. Because according to the statistics in 2022, many women who were vying for various political positions, the statistics tells us in 2022, 55% of women were attacked online. They are actually experience online violence. So it's being able to look at it, because it's multi-layered, it's messy, because that's how society is. But it's being able to say, what actions can we be able to do? How are we responding? How are we going ahead in terms of prevention? But most importantly, how are we using data and analyzing that data so that it's informing our actions?
Let me understand. So the online violence, women tend to get the longer end of this particular stick than the men.
Yes.
Correct. Yes.
And the perpetrators of this violence also tend to be men.
Yes,
Correct.
actually there's a study, University of Nairobi, the Women Economic Center, I think they did this with UNFPA. And I'm just reading, male students were identified as the top perpetrators, 78.6%, of technology facilitated GBV, like Rachel has said, followed by female students, 11%. And male teaching staff also threw their cards in at 5%.
Has it been asked, or if it has been asked, what has been the response to asking, why is it that even, because you're talking about a patriarchy, you think of older creatures like myself, but now you're talking about university, young people expressing these violent thoughts and views. Why?
My take, and I'll again emphasize I'm a Gen X, contrary to popular opinion. It's the territorial thing of, listen, this is our space, you're coming into our space. Typically or traditionally or conventionally, whichever word we'll use, men had the money, men had the say, men had the power. So we're in this dilemma where there's a shift. Yeah, there's a seismic shift. Actually,
but that shift started a long time ago.
It did, but it's very uncomfortable.
Yeah.
It's very uncomfortable.
It's also the normalization, because when it happens, nothing happens to me.
There you go.
So I'll just come and do whatever it is that I need. The platform owners will not come after me.
Yeah.
The legal whatever will not come after. The law enforcers will not come after me.
There's also
Tomorrow
something
morning
on
I just wake
toxic.
up and I do the same.
I'll continue.
It takes a much longer time.
Mtanipeleka wapi?
And it
serve
takes much
justice.
longer
But let me ask
time.
the question. Let me ask the question. The system that we speak of that is now pushing back was a system that favored men.
Yeah.
When you talk about equality, you talk about equity, then the imbalance that was there will be felt as an imbalance against them, because the privilege that was previously there is now being lost.
I love the word privilege. Yes.
So when the privilege
Yes.
is lost, one is saying, it's like you're denying me more or less a birthright.
Yeah.
And
These are my sweets. Why are you taking some? Yeah, I know you have no sweets, but these are mine.
yes, but then when the economic issues come in again in my mind is when you're not able to fulfill that role that you covet as a man because of circumstances beyond your control, then your response seems to be violence because you can't be the man that you're supposed to be.
Supposedly. And actually, there's a recent study that we've done again at the regional level. I'll keep bringing the regional voice because we want to see Kenya is not an island. Yeah, we want to see these are common in the context that we are in the sub-Saharan Africa that Latiff talked about. But toxic masculinity is one of the things that was identified in this regional study. And it says that it doesn't only harm women and girls, but it also harms men because of this kind of twisted thinking. There's also the factor of alcoholism. When you talk about Kiambu being one of the high numbers, I'm not surprised in a sense, as much as women, they are vocal, there's money in that county, but there's other vices that contribute.
Yeah. Is alcohol a problem or a symptom?
A problem. It's a problem.
Consider. It could be a symptom. Why do you have a situation where people decide to climb into the bottle? What is it? And then it's widespread. What's driving them there?
Right. So, well, the conversation continues, right?
Yes.
16 days of activism begin on the 25th all the way to the 10th of December, and we shall have conversations through the 16 days of activism. Thank you very much, ladies and gentlemen, for joining us, right? Rachel Kagoiya, Executive Director, GROOTS Kenya, Sylvia Maina, Regional Gender Communications Specialist at UN Women, East and Southern Africa, and north of the Limpopo, south of the Sahara, not going into East, West, and U.S. and where.
Exactly.
And Caneble Oganga, who is the Program Specialist for Gender Statistics at UN Women in Kenya.
This is the Situation Room, the only way to start your day.